It's a warm welcome to this wonderful program that you like so much. I'm Stephen Chongompuku. Remember, this is the Lusaka Apex Medical University Radio Grand Round. And today, like always, I have my special guest, Professor Turkson Lambert, to help me unveil and also discuss this important topic. Professor, welcome.
Thank you very much, Mr. Chongo, and thank you very much for listeners and viewers. Let's discuss.
Yes, indeed, we are going to discuss. Remember, you are getting us loud and clear on Radio Maria Zambia, Lusaka, and also Radio Maria Zambia, Chipata. Not forgetting our weather friends, Lumen TV. So, we now start by those salutations and also introduction of the program.
As usual. First of all, Amarumbo Kurilesa, extremely important song.
Our signature tune.
Our signature tune. And it's sung by our Apex graduate, the actually. Medical doctor now. She has worked very hard, 7 years.
Dr. Towera.
Towera, yes. And then greetings from our Vice Chancellor, Professor Njeresani. Our Chief Executive Officer, Professor Peter Mwawa, the driver of the whole company, and Professor John Mudenda, Director of Medical Education, and the Deputy Vice Chancellor, my colleague, Professor Mlenga, in charge of research and innovation in the university. And from all deans and all class representatives, the union, which we met yesterday, it was very exciting to meet the entire university union yesterday, and we were happy to interact. So that's the salutations. Then for Apex Medical University, please remember, we start with a song which says, prayer is extremely important. Morning, noon, evening, even at night. Don't forget to pray, because when you pray and work hard on your curriculum, on your textbooks, on your lectures, you'll be very successful. And when you are knowledgeable and skilled worker, health worker, you look after God's people well, wherever you will be. Thank you.
Definitely. You look after God's people. That's what is important as a medical practitioner. So, Professor, what are you looking at? You can
Today, as you are aware, Mr. Chong, we have moved from frontal lobe, parietal lobe. Today we are entering occipital lobe. Occipital lobe is at the back of parietal lobe. We can also say at the back of the temporal lobe. Now, there is a demarcation. As we were reaching the posterior end of parietal lobe, we said there's the parieto-occipital sulcus on the medial side. Now, when you draw a line, I'm saying so to the students, when we are studying the brain, you will identify parieto-occipital sulcus on the medial side of the brain, near the falx cerebri. You draw that line, extend it to the posterior end of Sylvian fissure, or lateral cerebral sulcus. That's another name for it. To the posterior end, then you have divided occipital lobe from parietal lobe. There's also a notch in between, So it's easy to identify that this is the parietal lobe and this is the occipital lobe. Now, occipital lobe, by grace of God, this is where neurons in charge of vision are located. Vision, what we see. The eyes will get what we see, but they transmit from retina to optic nerve, optic tract, the geniculate body in the thalamus, then down posteriorly to the occipital lobe. Now, occipital lobe, there's a special structure which our students want them to always remember, the calcarean fissure. So it's on the medial side, it's Y-shaped. These are the neurons around that fissure that will receive the images from the eye. That is called area 17 for students. That is area 17, the primary site that receives the images from right eye, left eye, going to the occipital lobes on the right, on the left. Then on the surrounding area 17, there's area 19, there's area 18, 19. Now I wanted to say that these two areas is to recognize. Like I see Mr. Chongo, I've recognized your face, I've seen you, what you have dressed. Immediately I see, this is Mr. Chongo. That recognition is interpreted by area 18 and 19 of the occipital lobe. After being received, the images being received by the area 17 along the calcarean fissure. That's how it is all done. Then I want to say that area 19 is very close to the angular gyrus. Remember when we were talking about language, when it is area of language, there's angular gyrus, supramarginal gyrus, angular gyrus, and the first temporal lobe gyrus. Those, they do talk about the language. It's language, all languages that God allowed us to speak numerous languages. In Zambia, we have 73 languages. And what a wonderful thing to hear each one of them being spoken. Now, when I see you, Mr. Chongo, my eyes immediately knows that, oh, I'm meeting Mr. Chongo. He loves speaking Bemba. I'm trying to connect the vision and the language. And that triggers the angular gyrus within the area of language, Winnike's language, which we talked about last week. That's why when I meet you, I will try to greet you in what?
In my language.
In Bemba, yes. I'm trying to be friendly and I'll speak you in Bemba. If I meet Professor Mdenda, he loves speaking Tonga. So I will say, Maukawuti, I'm trying to explain, to say that my eyes have seen you, and you love this language, so I'm trying to be friendly, extending my hand to it. When people meet me, most of them will say cerebral artery. So when a patient is recovering, one of the examinations we should do is to check where the dilated pupil was. Has the patient lost vision? Was the posterior cerebral artery involved in the pressure? Then just before that artery, there's the superior artery supplying cerebellar hemisphere. This is the area for coordination. So again, we want to check a patient who was involved in an accident and one pupil was dilated. At the end, we should assess, was the superior cerebellar artery affected? If so, that side will be incoordinated. So a patient to greet you will be missing your hand. We try to extend the hand, it can't reach. It can't coordinate to reach your hand as you're extending to greet. And when there's a special test we do, a finger-nose test or heel-shin test, those the patient will fail to do. Then it will tell us that, no, this accident affected the superior cerebellar artery. That's how we coordinate the whole thing for our students to understand when they are examining a patient. So now I can speak a bit in Nyanja so
Yeah,
that people
so
can
that we
follow.
now interact.
Yes. So lero tilukamba za bongo la kunkhontho uku kumbuyo kwa mutu kunkhontho uku ndiye kuti pangisa kuti tione kuti ija ng'ombe ubwera dzina lake ni Janet, ija mbuzi ubwera dzina lake ni Taferasoni, like that. Kuti tione kuti chiri ubwera nchakuti. So maso yatenga yakopa monga kamera, but bongo lipenya litanthauzira vonse ili kumbuyo kwa mutu. Samalani kumbuyo kwa mutu. Ngati mwana wamkulu wapwetekeka kumbuyo kwa mutu, vinga chitike vision iko zochoka upenya ulepero penya vintu. So ndibati lukambira na lero. Andi mutu ngatuwa vila kunkhontho na onso fikani kwa dotolo wanu mosa zengerezwa analinda kwau mutu wawa owa vila kunkhontho koma simu wona dokota yae. Please chitani mwachangu uona dokota. Kuliso kwino wawa kwa mutu kuchitisa chimbuzi maso osa penya bwino. Because the pressure is high. Manevu ya jamitsempa ya pereka mapikicha. Upereka kubongo la kumbuyo ya kala affected ngati pressure ilukwera. So musazengereze. Ngati mwauka mumvera monga musanza. Oro mwasanza kumene. Pitani msanga mutu wotero ni woipa. Wakang'anula uja ungo kwerera. Upita na mphavu day na day. Musazengereze yae. Na mutu wotero itanthaza kuti mutu mgakhale chotupa chimene chilu kwezeka mphamvu ya mutu, pressure ya mutu.
Zikomo kwambiri. At this point in time, our dear viewers and listeners, it's time for you and us to interact together. It is time for you to call and ask questions on the topic we are looking at, or occipital lobe in the brain, or any other topic, any other question that you might have. Nintawo yakuti imwe naise tikambirane mungatume lamya sopano so that tikambirane ngati mwina mafunso kula professor vatiyanke tipunzisane. So no nambala ni ya manager ya umwe tima using amamanta zonse 0972695200 0972695200. We seem to have a call. Hello. Wino mashibuken. Okay, wali sana tule pepa fiati buka faya akalupia muka lipire. Ain.
So nasamtwala ku UTH bayati mento alefa kama glasi. So ni chimutu wauko kile ku brain atalefa kama glasi.
Okay.
Kama glasi kushawa chonga 800. So naliwela ko watela kono muto oyanwa. Then chimbi ule muto changa ule kalipole kwa chaisa kukanwa. Chironda chafuma kukanwa nisinaena niyo ine ya ku brain.
Okay.
Chisuma
mkwai kene maske.
Chisuma mai mkamanga, yes. I've heard the question. I think there she's saying that she saw the ophthalmologist and advised the glass. She's either short-sighted or long-sighted. So the assessment, the picture that goes into the eye is misallocating. Either it's too much in the chamber or outside. So it's either short sight or long sight. So the glasses is to try and correct and bring it to a right position. So that the images can be taken from the retina to the occipital lobe. So the patient can see properly. It's an assistance. But I'm happy that they went and they have advised the glasses, and they will do exactly that, and the vision will be improved.
So the same happens to people who are growing. For instance, myself, nambo kango verenga pafupi maningi.
Yes. For old age, one of the things that occurs is the cataract. So cataract blocks those images for retina to pick, because cataract is in front of the retina. So it is not allowing the light to reach the area where the retina will pick and send to the occipital lobe. So cataracts should be checked as we grow older, especially those with diabetes. Okay. It comes earlier.
Then the other aspect of the question was that
the one headache with sores.
Yeah.
That is what we call herpes labialis. So with the headache and fever in villages at mutu wafuza lomba azakala bwino. Temperature nalyo kwera kwambiri amalira na mutu lomba vironda vaoneka ati mutu wafuza. No, that one of course you can interpret that way, but it's a herpes labialis and there's medicine to it. If you feel that the sore has started and you put yourself or go to the doctor, they'll put you on acyclovir and it can cut those sores.
Okay. 0972695200 munga tume futi wenzo tuma panali kusisa kuyanka funso yamene mwezi matuma. So munga tume futi 0972695200. Hello?
Hello, alibwanji.
Bwino alibwanji. Okay.
Na BP na sugar. So mu na chitena
chani?
Mtima.
Mtima.
Vampina ero na mutu ukondola pakati. So nimaenda ku hospital kumalizio kumaniuza kuti chabene chilavisa mutu ni BP. Nanga mtima ngafunda kuti mtima wonse ni BP. Manje ndinkhala ndawe ya Italy univuta malingi.
Yeah, very good question.
Ziko mama munga katinge
mumvere. Chimene nifuno kamba ni vambiri vantu ana ma high blood pressure, ana sugar. Chifuniko dziva vakuti vonse viviri vikhala controllable, vingakozeke, vingalandire treatment tandizo kuti vonse vikozeke. Mukhale pa mankhwala ya BP, mukhaleso pa mankhwala ya sugar. Please ikankoni zero. Ngati one of the two sikhala well, ichita damage the body. But ngati vonse viviri very well controlled, you will enjoy your good health. So, blood pressure, vambiri apanga mistake. Akutaka mwabwerera pansi bwino vasiya kumwa mankhwala ati inakhala bwino. Blood pressure si khala bwino, ni maintenance, sizaleka, but mankhwala mwenera kumwa tsiku na tsiku. And ngati blood pressure yanu ipitirira pa 140 systolic yapa mwamba. Yapansi sapitirire pa 90 diastolic. Ibwere pansi 130 over 80, it's okay. 120 over 70, it's okay. But ingatipita 160 over 110, that is very high. It's damaging and it causing a headache. Ni mwai kwa vajamvero mutu vava. Vambiri angoenda navo njufwa chaka kuti ni silent killer. Plus sugar ija iwononga njira za magazi. So vikagwirizana viviri viwononga tupi mwamsanga. So advice kwa amai napita, please pezani kwa kuti akuuze ni bwino za blood pressure na sugar na mmene mungachitire control. Musazengereze.
Musazengereze nditu. We might be having another call 0972695200. Okay, mungatume futi 0972695200 0972695200. Hello? Hello?
Hello, ndine mankhwala ni mama. Mankhwala ya sugar na BP.
Good.
Mankhwala ya sugar ni mama dawa ndio na metformin ero ya chiteki ya BP nimamwa enarapio na amlodipine na aspirin
amlodipine aspirin aha
nimamwa every day pakana manje sopano namwa kudala
eya lomba kuti mudziwe kuti mankhwala yanu yasevenza muzipima like sugar yenera obwera pakati pa 3.5 millimoles to 5.5 millimoles, but oleta fika 6 or 7 it's okay. Isapitilire fika ku 10 fasting blood sugar. Blood pressure mujanna kambira isamapitilira pa 140 over 90 ya pansi. Ngati si imakwera upitilira hapo nde kuti mankhwala yanu either dosage sili bwino o combination ya mankhwala ayang'ane ponso wa dokota. Musakazikire chifunika nupima udziwa kuti vakhala controlled oloyai.
Ninagula ka machine ka BP.
Good.
Na ka machine ka sugar.
Very good.
But ka sugar kite BP pake neima kwa mangala 145 over 75 or over 60 something. Elo monga ya sugar. Zao na 8.2 9.2 so chabe kamosi wamene inafika 10.
Oho. Ngati ni fasting iyo blood sugar sili bwino ngati ni fasting. Mwike konzeru nditu pa mankhwala na diet.
Okay.
Mpaka ibwere pakati pa 3.5 to 6 or 7 kasako. Isamapita kuma 8 kuma 10 yai.
Okay.
Ziko mamai ziko.
Okay, 0972695200 ndiye manamba lamu. Ungapitilize kutuma so that titenge ma calls. 0972695200. Hello?
Mwaka banji
Tauka mfumo mwaka banji.
Tauka bwino. Andine watu mtumira kuno Lusaka.
Chabwina.
Last time napa tumako ndiye tax driver napa sitako student Burundi. Tena kwenda kwa Zimbabwe napa sitako. So nimeona nanga na raw vision. Nianza kuna problem ya kucontrol side kwa tuna ngana patari maningi. Kapaji fuko njani ka.
Maso yose abiri?
Yose abiri mangana oroka wana 18 hours. Nimapa kinga so mangana mchepa fupi tunangana kutari maningi so sinijua ndio kuna kati kwa huko mtu hapo so
ya mwene ro checking isa maso yonse abiri andi kumbuyo kwa diso uko tiwone ngati nali post traumatic nanga mazi yaenda bwanji mutu muli mazi mutu kadi ngati kuoneka kuti kuli chimbuzi awone mretina kumbuyo kwa diso ndiposo azayang'ana no wona ngati kuli scanning tichite CT scan wona occipital lobes.
Okay.
Ponse pavili vichitike.
Okay.
Zikomo
kwambiri mungate kutuma 0972695200 tikutenga makoza. Hello?
Nime matches.
Yeah. Cheston.
So, ile makana problem ya mtu. Mtu imazina concentration. Then ni makala confused sometimes. So last time remember like 2017. So 2020 napona ndaona Dr. Winango. Bana nipata kwa kamba kanisa mali. Then mazenzi ya kumbuyo kumuma ndekela sometimes kunga. Kuma baba but makati confused sometimes. Watina sokana kama kopija. Then kumbuyo kusuma mazenzi ya kumbuyo. Kuma kama kwa chineti. Kwa chineti kulishabia something tete ni nyelekeza so kumbuyo kwa mtu. then a mess again, putting Langani Bunobino so meso. In Maconisa Bunobino Langana. One is Langani Malangana, but this is Mr. Bullemis and Langani Bunobino. Yamakla, you put a song like confused.
Yeah. So now confusion ye mukamba ili motani simuchita recognize vintu vijamipenya or confused out you can lose direction or wanji.
Confused like maybe in direction.
Aha. So ndiye jana rukamba ya parietal lobe jaya last week parietal lobe the previous week.
Okay.
Tinakambapo. So mufunika mufike kwa dokota, and one of the things they will do is to make sure they do EEG. Tione electrical activity yama brain yanu isevenza banji. Like itiru kamba lero ni alpha tracing. Frontal lobe ni beta tracing. Parietal lobe ni mixture of beta and alpha. So awone pa EEG. Ndiye one of the examinations they should do. Then vision are checking nayo vision. Tione ma occipital lobe ya sevenza banji. Ziko.
Okay, ziko makwambiri tukaititenga makozi. Hello there.
Hello.
Yo.
Moka bwanja doctor.
Tauka.
Tauka pangono. Ine muntu niko na problemu. Nina mwendo wa left. Mwendo wa mine ukadende ne kuwa maningi yoshoka andi nthawi zinangu machanga timulikantu kaluma so. So kuti nje makilomita viatali so imamvera kulava maningi. So sinzo tukojivuta imalengesa hivi
nchani. And in one side chabe?
In one side chabe.
Okay. Okay. Simna chitipo accidenti?
Hai.
Okay. So chima mnazaga zingati?
Nina 55.
Maweti yanu ili banji weight?
Weight ili 72.
Okay, you are a light man. Okay, so what happens in some patients, kuma kula kantu pansi paka dendene, pansi pamwendo hapa. Ka spa. So mkambo yenda paja, muchita trigger ma nerve endings. Yawa visa mwendo. Yachoka paka spa kaja. So one of the investigations your doctor should do is to do an X-ray. Especially lateral view. It can show what is happening there.
So is there a corrective measure?
Yes, it can be corrected.
Okay. 0972695200. Hello? Hello?
Hello?
Hello. Ku background kumve kachongo chikani radio kanchani. Oh, it's us. It's us delayed the audio.
Okay.
Okay, can you just reduce the volume? Tizimbe na tezo kamba pa face. Oh, it's a bit behind. Okay, you can go ahead.
Is that where Professor Lambert is?
Yes. Yes.
Okay. No, me, I'm a patient of a stroke. For the past 18 years. I went to the hospital to be examined in the MRI brain.
MRI, yes.
Yeah, they found that you have got the abnormal signal in the Ganglia region of the brain. Yeah, that was the examination.
Lomba munafoka mbali yakuti kuzanjala manzere kuzanjala manja kumene kuna zizira.
Ni kwanja na kwendo.
Ku right or ku left?
Ku right.
Right.
Yeah.
Muri right handed mumadiera na zanja narudiera zanja lolembera ni la ku right?
No, ni diera manje ku left.
Okay.
But the face was ku right.
Yeah. You must be a very lucky man. You have every reason to thank God because your dominant brain is the one that suffered a stroke. You could have lost the speech, but here you are talking to us. We thank God for you because your dominant brain had a stroke. The speech is located on your left brain if you are right-handed. But we thank God, yes. So, vilibanji treatment ilibanji, mululandila mankwala.
Treatment, maenda hospital, wanani mbelako mankwala, yamene laka mbaguti aspirin, then wanani mbelako na mankwala enangu, yamene likumwa.
Simunga yakumbukile
zina. Danga blood pressure yanu ilipoti.
Blood pressure yanga iliko kasako pansi 95, 90, pamwamba 130.
Okay. So ya pansi ngati 95 siri bwino niyokwera. Mupite kwa dokota wanu achekinge mankwala ya muli kumwa, please. But yowa pamwamba 130 ili bwino. But bwelelansoni makamaka ngati mumvera mutu wawa blood pressure siri bwino. Now I want to chimene nifuno chita explain strongly. First stroke wambili wa machira 85 to 90% wakala bwino. But the most important is to avoid the second stroke. Musanzengerezo landila mankwala ya bwino no chita control blood pressure. Because the second stroke you lose more brain. Don't allow yourself to deteriorate to get another stroke. Please, ikankonizero ku healthy ziko.
Sure, but when I take moderate and in the Philippines, BP comes down very well. Sure, it comes to 80 by 120, 130.
Okay, but what the professor is saying is that in Mukainde hospital they can know the dosage and you explain all those things.
Yes.
They will be able to.
And in further pain na modulating viscerals abwino, you maintain like that. Keep checking. Yes, visakala bwino.
The other thing I'm asking, where is your hospital or clinic so that we come there? Where is your hospital or clinic?
Muwafunse chongo tikata program. Mwachitile phone.
So that we come there and see you.
That's okay.
Okay, thank you so much, sir.
Can I use the same number?
The same number, yes, immediately after the phone, after the program. Yes, you can call. The person on radio will give you.
Okay, thank you very much.
All right, thank you. Okay, 0972695200. That's a power line. We are getting your calls on. We have another call. Hello. Hello.
Hello.
Bwino mwasenza bwanja mai. Kati? Kasanga.
Kasanga ni ka cataract.
Cataract.
Ni ka cataract.
Ati nchancha mechi maleta?
Kanamela pakati kalinzo.
Okay.
Tawama banza tafuna 4P operation.
Mankwa Kasanga munaza kazingati?
Na 42.
You are very young. Na dwalapo sugar problem ya sugar?
Ndi sugar ni BP but na low BP.
Low BP. But anyway, ngata katsimikizira utini Kasanga. Ndeka luchita bloko kutimu penye mbali ya uko simunga penye. Chukua kavala njira. So ngati wa dokota kamba kutafuni kwa kachosa kutimu penye bwino. Anga chose kuja kuchawama mwakamba kuja. Mza penye bwino. But yes, akachosa kuna konsuka kusaidi kuina ayanganepo. Kuliberi yonse problem. Very good. You are lucky. Ziko momai.
Zikom. Right, thank you so much. We have about 15 more minutes before we wind up. I will still continue with the calls. Hello.
Hello.
Yo.
Mwaka bwanje.
Bwino mwaka bwanji.
Mwaka bwino. Ile niko na funzo kwa dokta.
Yeah.
Nikachoka kusamba. Umaswetinga pata nimenazi ngisamele ngandela. Same nikatoka na koide imangala na nyoza. Nimwanani hapo imoja.
Muma samba mazi yokupi oyo uzizira.
Yanga yokupi yanga yozizira imambere.
Ninjo tachabe amemavera. Utamanga. Okay, I think we've gotten the gist of your question. It's only that the line is not too clear.
Nina problem na kumanja. Chikumo shikulu chakula concept side great na kuma baba. Chima kwanya tu. Ijade naonga kenjo kupya chakula no kodo.
Chikumo chikulu chicheka?
Wote
viviri. Okay. Okay. Ziko mkwambiro bazanka wa professor.
So akachoka mkusamba ambela mtimo chaya
na chilaka wakamwako manzi ndipe wapema olo wakachoka ku toilet.
Okay. Same. So I think what she needs to do, even in hospital angawa chita admit for a short time, wapeleke na tenge shower or bath mu hospital setting. Then pajaru mvera lomba mtimo luchaya and all that, depo mvera mumtima lomba. First heart sound, second heart sound, kuli noise yotani. And the speed yake libwanji, vichekingiwe. Because there's something that is provoking the reaction of the cardiovascular system. So it's better to check that. And mvera kuti vyara navo, viruvutisa, and it's both sides. Lombanga tini both sides tamagiro na ma nerve roots mumkosi. Where the nerve roots are located. Tichekinge. Ngati amvera na mutu su kalabuino. Then we are going back to the frontal lobe, motor cortex to check. So from motor cortex down along the internal capsule, down the pyramidal tract up to the fingers, the cervical spine, tuone marutsi ya libwanji. So vifunika pimiwe from head to toe. And hawezina is better wasunge kuchipatala. Awa checking pajawachoka ku bathroom. Chichitika nchota.
Okay. Thank you so much. We are still getting those calls. Hello, Cora.
Hello, Mulibwanji.
Bueno, Mulibwanji.
Na Francis Matero.
Good.
Ile problem yanga saa ni mankara maningi na ukiambia 2017 ni maningi na challenge ya
Shidima.
Ningepeleka sometimes nienda zime jaribu bana hapo sometimes ni jambo cha tena distance. Then kumenya so blackout. Nizanga la pepa ja sometimes nangala depends pia na ukanaimba na yeye. Sasa pakati hapa na box kama 2018 19 20 21 na box asira. Bati hapa yamba futi and then ni mangapa ni kwa tereja chiswe. Chiswe mkumendo sometimes na kumanja. Na kama ningi na challenge ya chiswe na bana hivi. So hizo are the reason why.
Nanga blood pressure yanu ilibwanji.
Ni karibu enda kwa
msakazikire yae and vambili achitatere kutachita kugwa pansi ni low blood pressure. Hypotension is another problem. Mona akagwa achita recover. Low blood pressure isichita supply blood yokwana ku brain. So brain ichita demand utitupirigwe pansi so that the brain irandire blood. Is the most vital organ in the human body. So the brain receives the blood ngati muntu wagwa na pansi. Then ayanganuka lomba it has received and it recovers. But it's better bwelele ku hospital akaone blood pressure ilibwanji ziko.
All right, 0972695200. That's the number we are getting your calls on. You can call and we'll get to have your question answered. Hello.
Bueno mai bwanji.
Nilikuwa nafunza kuliwa doctor. Nina sister wanga na BP ikankala haya amamvera muntu kubaba ku one side then kutu ibwerere pasi saka bleed mumpuno nishini cyane.
Okay. Katingani kuko bazaya nkamvere.
So certain people react with blood pressure by releasing epistaxis, by bleeding. And that's not a good sign. It means the blood pressure it's not well controlled. And it's not good to continue like that. Because it's damaging other organs. Most important, please abwererenso ku hospital. Akapime blood pressure, awone mankwala alulandira, and wantu waso sanero tenga aspirin. Because aspirin will make the bleeding worse. So the doctor there has to be very careful on how to do it. But history ipelekewe kwa doctor wao. Azawatandiza.
So amai wakamba kuti it's not good per se chifukati awe wakableedinga ndipe wamankala kubwira. Musachita rely pali veka. But mafunika mwaenda ku hospital vayangana apo va doctor. 0972695200 0972695200. Hello?
Hello, Mauka bwana.
Bueno Mauka?
Mauka. Ine nina puto mutu ukava maningi futi vilonda vinatoka last week yo. Futi lero, futi vachoka. So manje nifutako ninga dema futi bwanje lo mukwala wamene ngamo. Vilonda vileto kuchoka ni mukwala bwanje.
Yewo. So mukapita kwa dokota vanu muwauze mwanu makambira pa radio kuti vilonda vimachoka no wawa kwa mutu. Then uwawa kwa mutu kujenga kaena fever. Fever ndiye rupangisa vilonda kuti vichoke. Mwana kambira kuti kumidzi akaona tempaja kuti lomba mutu wafuza. Lomba zakala bwino. Nukozi ni virus ni herpes labialis. Mankwala yake yaliko ya kuti mngamwe tungachoke uto. Bati bwerera ni kwa dokota wanu. Mukawauze mmatuzira tere. Musazengereze tuzi kuvutani tero mpaka fever ikala controlled na mankwala mena.
Tambera mukaende ku hospital. More calls before we do our winding up. 0972695200. Hello?
Hello?
Hello mama.
Mashuke mkwai.
Mkwai mashuka shan?
Mashuka shiwini.
Mkwai.
Inena alikuwaza kuobwasya ukukule side. Left side paluku mwapa. Nomba side pama langiza. Pala ngana ladira koso kula kadipa sana.
Kulefti?
Ndatiba sana nda swetinga sana ikiwe. But naliako kusani kwa tipaka wata. But banje asachionze zifyo wina. Nomba sishirevera kufyo no kuboko kule aba affected no kubu
kulefti
na mumma tuna mwena muladire ekintu ngala bampe ya period
ni kulefti
ndambo kumfamile ekintu atifu kwa cyo ngufira kono bakwati musaini
ndepshati ni kulefti mulelanda ukulu
ukulu kwa kulefti.
Okay,
so it's the leg or the arm?
Both. Ukulu no kuboko ine
kwa ukulu no kuboko then no mtuna panting
na
passing na ladira koso kune kule side.
Okay.
Na sweating sana.
Okay, chisuma valask.
Nanga blood pressure yanu ilibanji.
Bati ye nanga na apimisha ila base normal don sweating na apimisha. Yaani nine for the last time ni chaka dipa sana.
You see, she also has the noise in the ear. Is it the same side?
This niku same side kuomfya kukutwi.
Kukine kule side, kukine ko tira na mumati.
Na mumati.
Yes.
The sound, especially when she's starting her menses.
Oh.
That's the sign now she.
But the blood pressure yawa alibo kambati sana checking.
Ati bakambati nomba imo nomo enu tumato ama numbers ama figures of yapa pamulu na panshi.
pamulo po yani neko panshari penomo
yarandeni kwama figures range ibashanishani
pamulo last time mbalembera tiari kwati wanu kama namana pe book but pako kola.
Okay. No, I think you see there can be multiple side problems. In the ear, it's a tinnitus. And the tinnitus, something is going on in the ear. We need to check the ear. So ENT clinic is very important. Then there's always a tube between the nose and the middle ear, eustachian tube. Now you also have checking because in the enga kale blocked, causing the ear problem. It's one-sided. Then there's an X-ray which we do for mastoids. We do AP to look at both mastoids and do lateral where the problem is. It can also show us what is happening to the mastoid. Then the upper limb and the lower limb, one side only. We must check that. And if it's involving upper and lower limbs, we look at the motor cortex. What's going on in the pyramidal tract? Because pyramidal tract for apex students, they know where origin is. The pyramidal cells and the giant cells of Betty are all in the motor cortex. So we must follow from there up to the end, to the, to the end of the pyramidal tract, where there's a decussation at the bottom end of the brain stem. So our students would follow all that and make an examination and make a diagnosis. That's where we are insisting, to know all this so that they understand the human body properly.
But weza kamba kono kama twakagonera ku left hapa side pali malungs hapa na mimba hapa side kubaba.
Yes. So the heart must also be checked. Any left-sided pain and the heart must be checked because we don't know whether it's angina pain or is it a stressed heart. No. Okay. Anyway, she needs to revisit the doctor.
Right, due to time, we are unable to...
but I wanted to say, Mr. Chongo, we are still enrolling our students. And I'm very grateful to people. They are really sending us a good number of students. But we are still enrolling in all the faculties. And please, we have extended the enrollment up to 14th of February. Send your students, especially now that grade 12 came out. Don't delay your children. Get your child. Let them start training quickly. By the time years are passing, they'll become graduates of Apex. Chipata especially, ambuye wanusachita phone. But Chipata, we are enrolling in Chipata. And Mr. Njovu is there receiving them. So we want also the people, that's why Radio Maria is there. Please enroll your children now, because some were saying we are waiting for grade 12 results. Now, but the results now
are out.
Yes, let them go to the start training so that they become professionals. It's nice to have many health workers. Have you seen now, they even come to recruit for UK. They were here recruiting.
Yeah. Thank you so much. So, Mambera, make sure that you send those children to Apex so that they become medical experts. Thank you so much, Professor. Next week,
thank you.
We'll be waiting for you right here. And this is where we come to the close of the program. We hope you've learned one or two things from what Professor has shared today. And for those of you who are not well, we wish you all the best. May you recover well. May the good Lord heal you. I'm Stephen Chongompugu. On behalf of my studio guest, Professor Lambert, bye for now and stay blessed and stay healthy.